Good morning, everyone. Welcome to Ischemic Heart Disease Awareness Pool. As we all know, the heart is very important organ in the entire human body because the heart carries and pumps necessities to other various parts of the body. Any defects or disease inside the heart immediately affects the supply of oxygen into the vital organs like brain, kidney, liver, and some different parts of the body. One of those diseases and the most common cause of death in many countries around the world is the ischemic heart disease. First, I want to share about the circulation of blood through heart. Oxygen for blood returns to the body, to the heart. Blood returns to the superior vena cava and inferior vena cava. Blood returns to the right atrium. After the right atrium fills with blood, the tricuspid valve is forced to close. And the right ventricle contracts, blood is pushed through into the pulmonary valve and into the pulmonary artery which go through two lungs. In the lungs, blood undergoes gas exchange, becomes oxygen rich. Oxygenated blood flows back into the heart by pulmonary veins into the left atrium. The left atrium fills with blood and contracts, which opens the mitral valve filling the left ventricle. The left ventricle contracts, which opens the aortic valve through aorta and through parts of the body. Let's go back to ischemic heart disease and what all about this. Ischemic heart disease is the term given to heart problems caused by narrowed arteries. When arteries get narrowed, less blood and oxygen reaches the heart muscle. Ischemic heart disease are also called a coronary heart disease and a coronary artery disease. A coronary heart disease is a disease in which waxy substance called plaque build up inside the coronary arteries. Coronary artery disease is impedance or blockage of one or more arteries that supply blood to the heart, usually due to atherosclerosis. Let's go this illustration. This is the normal heart artery, and this is the artery having plaque inside the arteries. This plaque is combination of lipids, cholesterol, fats, and white blood cell that may dead. Forming plaque into these arteries reduce blood flow into the artery that can affect the supply of oxygen into downstream parts of this artery, and this is called the coronary artery disease. If the heart muscle can't get the oxygen or blood that it needs, the signs and symptoms and complications will maybe occur. Thank you.
Common signs and symptoms of ischemic heart disease. You may experience ischemic heart disease daily or just occasionally. Common symptoms include chest pain, chest pressure, indigestion, fatigue, sleep problem, nausea, or with or without vomiting. Serious symptoms that might indicate a life-threatening condition. In some ischemic heart disease can be a life-threatening, seek immediately medical care or call 995 if you or someone you are with. Thank you.
Angina Pectoris. This is characterized by the severe chest pain due to the ischemic heart disease. It is caused by the obstructions of the blockage of the coronary arteries. As a result, the arteries prevent the heart from getting the oxygen it needs to function. The pain that the person experiences when exerting is called angina pectoris. Heart attack. Another common complication of ischemic heart disease is acute myocardial infarction, or a simple terms, a heart attack to the person increased cholesterol levels and deposit of fats. The arteries become narrow. This can develop a blood clot and significantly lessen the flow of blood and oxygen to the heart. Thank you.
Lifestyle changes for ischemic heart disease. These are the prevention of ischemic heart disease. Don't smoke, regular checkup and control blood pressure, avoid body food, fatty food, treatment of diabetes, keep healthy weight, more exercise and relaxation. And the example of the exercise are hiking, as you can see on the board, hiking, biking, running, jogging, swimming, or aerobics. And to reduce the stress, you need to have enough sleep or have creative works and have time for your family. And to prevent the ischemic heart disease, you need to visit the doctor to prevent early ischemic heart disease failure. Thank you.
Home remedies for ischemic heart disease. As we all know that health is wealth. I'm here to report the healthy food and unhealthy food. Healthy food consisting of fresh fruits, vegetables, and fish would go a long way in reducing the cholesterol along with sodium salts in an impeccable manner. We need to avoid unhealthy foods like processed foods, unhealthy fats, to avoid ischemic heart disease. Vitamin D. Our body makes vitamin D when it is exposed to ultraviolet or UV rays from the sun. And the food sources of vitamin D is fatty fish and butter and fortified milk. Thank you.
Natural supplements for ischemic heart disease. Omega-3 fatty acids is a type of unsaturated fatty acids that help decrease inflammation inside the human body and can aid natural supplement in ischemic heart disease. Fish and fish oil. Fatty acids along with salmon, herring, and impeccable tuna. Example of supplements. Omega-3 fish oil. Omega-3 fish oil aiding in weight loss, fertility, pregnancy, and more energy. Example of essential oils is lemon. Lemon is the one common of example because this one can help relieve from fever, less weight, and this most especially is control high blood pressure. Thank you.
Ongoing care is important for coping ischemic heart disease. Patient cholesterol and blood sugar level in the body should be closely monitored. Lipoprotein measure the cholesterol in the body. In addition, blood glucose test helps to control resulting in healthy life. Doctors can help control the risk to the cardiovascular system of the body. Tests need to be scheduled after consultation with the doctors. Thank you.
I'm here to discuss about the medication of ischemic heart disease. Medication needs management because medication management plays another role in ischemic heart disease. As a nurse or caregivers, it is very important to provide education to the patient about being compliant with medication, how to take them, and possible side effects. Medication includes nitrates, antiplatelets, statins, beta blockers, diuretics, and calcium channel blockers. Patients take this medication, may feel dizzy or hot flushing after taking. So monitor the blood pressure of the patient. That's all. Thank you.
The right treatment for ischemic heart disease, well, depends on how risk your heart disease is and other factors such as your age, your other medical conditions, and your personal preferences. There are two types of surgical procedures treatment. One is angioplasty and stent placement or percutaneous coronary revascularization surgery. And the other one is the coronary artery bypass. Thank you.
There's a related information about ischemic heart disease in Singapore. In May 2014, according to World Health Organization, Singapore ranked 131 in the world cause of coronary heart disease. From 2014 to 2016, ischemic heart diseases ranked third in Ministry of Health statistics. It creates the highest burden of all for Singaporeans due to its high rate of mortality. The Health Promotion Board implements the following health programs to address health concerns among the community, includes community health screening program, physical activity program, national smoking control program, nutrition program, health information center, and helpline. Many private clinic and polyclinics offer comprehensive health screening for a variety of health concerns. And this is the government and private hospitals offer different kinds of heart screening. Thank you so much, everyone. Reporting Julie Antonio.
Dory Nanayan.
Lili Tamayo Dilag. Daisy Villanueva.
Mita Alibre, Novelita Obena,
Mylene Clutario.
Evelyn Gutario,
Giselle Lapine.
Edeline Sabanyan.
On behalf of Group 3, we would like to greet all of you a blessed Merry Christmas and a prosperous Happy New Year.
Thank you.
Thank you.